Yay. Well, I am so excited. You guys have a treat today. I consider Hillary my friend for sure. I'm like, we've been sitting here talking before we even first record because we have to catch up. So, um, I'm excited today to have Hillary with us. Hillary is my thyroid. She's my lifesaver. I'll just say that. She's the one that's made me feel the best. So I'm grateful for her. She works for Modern Thyroid Clinic. So I'm just going to let her introduce herself and then we're just going to have a conversation today and just chat. So,
Yeah.
Hillary, welcome.
Hi, thanks for having me. I'm really excited to be here. Always excited to spread the news of this. Like it
Oh,
just is so needed across the world, really.
yes, it is.
I am Hillary. I am a nurse practitioner at Modern Thyroid Clinic. I have been there going on 3 years. I have been a part of their like nationwide expansion, which has been really neat to see. Just the distance that we've been able to take thyroid care. Um, I live in Texas. I'm from Texas, born and raised. Um, I have two kids, love them dearly. They're two girls. They bring a lot of joy to me and obviously married too, but yeah, love what I do. Can't just think it's just such a needed thing. So
Your daughters
excited.
are adorable too. They look just like their mom. I'm like, they're adorable.
They do, they do. But excited to be here and excited to, I don't know, see where this takes us and what you guys can learn from it.
Well, I was excited because I knew this time was going to be like crazy for everybody, but I didn't care. I was like, we can record it. They can all watch it later.
Yeah.
And we'll just kind of talk about what I've been hearing from them. So, your specialty is thyroid care. Thank the Lord for all of that because I know we were just talking before we started here for 32 years. I had people telling me you're fine, you're fine. And then it was, oh, you're not fine, but here, take this one medication and you'll
Yeah.
be fine. And it was not fine. So let's talk about your different approach. Let's talk about kind of the differences because I don't think people really understand the difference between functional thyroid care versus
Yeah.
mainstream. We'll call it
Yeah.
mainstream, or I don't, is that what you would call it? Mainstream
Yeah,
thyroid care?
conventional, mainstream, traditional care. I mean, they're all kind of under the same umbrella.
Yeah.
I probably call it each one of those every single week, every day.
Okay. Okay.
So
I'm like,
that's great. That's wonderful. And in fact, that's what I do every day too, is um to kind of talk about what we do versus what you're going to see if you were to go to kind of a traditional endocrinologist or your PCP or even like your OBGYN, like what do they do compared to what we do? So probably the biggest difference in what we do is that we do practice thyroid care very progressively. Um, we have, so at our practice, we are in the same boat with you as far as our clinicians go, and pretty much everybody that is hired on at Modern Thyroid, we all have a thyroid issue in some capacity. And so one of the biggest things is that we all have that empathy of understanding what patients are going through when they get told that everything is fine and they're normal. So I think that's one big difference is that when we went through this ourselves, we just realized like this, there's got to be a different way. I'm not going to accept this as an answer that I have to live my life like this for the next 30, 40, 50 years, however long I have left, right? Um, and so through the course of that, we started to look at it doesn't appear that the treatment method that traditional endocrinologists or PCPs or OBGYNs use is really helping people to get their life back and to feel good. And so that's one major difference is that we do use medication, and I think medication can be such a great tool to utilize and to incorporate, but I think it has to be the right medicine.
mhm.
So we're going to incorporate a combination of T4 and T3 therapy, which current standard guidelines are one class of medicine, which is levothyroxine only. Across the board, we see that work maybe 5% of the time, maybe even less than that. So it's just not a method that works really well. That approach hasn't changed in decades. So thyroid care just hasn't really progressed. In fact, I think we're going a little bit backwards, which is really sad and really just very heartbreaking as somebody who does this for a living. Um, so we're going to utilize like a couple of different treatment options. We want to get your thyroid levels perfect. And so I think that's another big issue with kind of conventional or traditional medicine is that they use these very, very wide reference ranges.
Yeah.
And
And
I
they're
think
all
just
different.
and they're all different, right? Like, so there's no set standard. You go to your lab here, somebody goes to their lab in Texas, completely different. Somebody goes to the lab that's down the street from you, or and you go to one across town, completely different, right? So there's just no set standard on where thyroid levels should be for people to feel good. There's this average, and that average is really taken of people that have symptoms. And why do we want to know what people that don't feel good? Why do we want to know what their levels look like? I want to know what people who feel good, what do their levels look like? So one of the biggest issues is that the ranges are so wide.
Yeah.
Every single day I see people that are normal in those ranges have thyroid symptoms. And when we start to adjust their thyroid and get it into a more optimal place for them, they feel better. Those symptoms go away.
Yeah.
So there definitely is a difference between being normal and then sitting in a very tightly controlled optimal range. So those are probably the biggest differences um, between us and like something you would get from just a traditional practice.
Well, and I remember before I met you and Modern Thyroid Clinic being in this other mainstream and being told that it was just the way my life was going to be. And
Yeah.
I remember telling my my doctor, I said, you know what, I'm not going to accept that anymore. That's not okay with me because this isn't okay. There's something better out there. You guys just aren't getting it. Like,
Yeah.
and I don't know what it is, why we cannot wrap our head around we need an active thyroid medication as well as the
Yeah.
inactive. Like, I don't understand it to this day. Like, I'm just as baffled as you are because I know
Yeah.
when I started learning about all this, I still remember the day that I took McCall's thyroid class, like what, 4 years
Mhm.
ago or however long that's been. I don't even know when she
I think
started.
she started that in like 22, so
Yeah.
24, maybe end of 21 into 22.
And
So
I remember sitting in this class and her talking about T3 medications. And I remember screaming, I was bawling, I was crying. You mean this
yeah,
one medication could have changed my life for the last
30
30
years
years?
ago.
Like
Yeah.
I was so angry. I remember feeling so angry. Like, and then to go talk to a doctor about that medication and them tell me, no, it's bad for you and you can't take it. And it's like, oh my gosh, like,
Yeah.
they're like all against it. Well, yeah, if you give me 50 milligrams of that twice a day, that's going to be a
Sure.
problem. Like,
That's scary,
'cause-
right? Yeah, I mean, in school, we have probably like an hour of training on thyroid care, and
Mhm.
it's really you draw a TSH. I guess that's the other difference is a full panel of
A
labs, not
full
a
panel.
TSH reflex to T4 or TSH and a T4. Like you need to see beyond those two levels. What is your T3 doing? What is a reverse T3 doing? Do you have antibodies? So that's also a big difference that I did mention. But um, yeah, in school we have draw TSH if it's flagged red, if it's above, now they say above 10. When I went to school, it was above 5. Um, if it's above 5, you treat and you treat with levothyroxine alone, and that's it. And you get them to a normal level. You don't want their TSH suppressed. Suppression is bad. It's going to cause all these issues. When in reality, it's not that the suppression of the TSH is the issue. It's that we put people on a crude oil hormone. That's a term we use all the time, which is inactive. And we have people that stack it up and then they just cannot utilize it well. And so adding T3 into a regimen can be so life-changing
Life changing.
and quickly.
Hmm.
It can be very, very quick. So
Yeah.
that's,
That's what I remember about working with you guys is it literally turned my life around in just a few short weeks. Like it didn't, I don't even think it took that. Like it
yeah,
was
sometimes it's a matter of days
It was.
that,
I just noticed that all of a sudden I wasn't crashing during the day, and
ah,
like it literally changed my life in such a short period of time, and then I went from that to where I am today. I mean, it's like a life changing.
yeah. I
Holy
always
shit
think about
balls.
women like you who have struggled with this for decades.
Hmm.
And to see them as the powerhouse that they are currently, or
Hmm.
even when they first come to see me and their thyroid labs are everywhere, not in a good place at all. And just to think about what more could they have accomplished in that time. And anyway, so those are just things that I see and think
Well,
about a lot is you have these women that are they're powerhouses already. but they've
Mhm.
dealt with this thyroid issue for many, many years. And how much more could they have impacted?
Oh, the big note thing that I noticed, well, I remember the day that I realized that I was feeling better because I was doing an in-person retreat at our cabin and I went up the weekend before to clean the cabin. And before when I would go do that, I'd always think, gosh, I should hire somebody to do this. I'm too tired to do this. I just don't have
Yeah.
the energy to do it. And I went up there and buzzed around and cleaned the cabin all weekend and had like, and I was doing stuff like dusting the high fans and like doing all
Yeah.
the, you know, and I
Yeah.
remember sitting down and thinking, oh my gosh, I'm not tired.
Yeah.
Like it was this moment of like, oh,
I can do the things I need to
yeah,
do.
I can live my
Yeah.
life. Like this is life to me. Like
Yeah.
this is what we should be
Yeah.
doing. And I have noticed too a big change in my work too. And like the I don't know, it just changes everything when you are not in a brain fog, when you're not
Yeah.
so dang tired, when you're
Yeah.
not, it's life changing. Like,
Yeah. Mine started probably right after I had my first daughter. And, luckily I'm in the practice of medicine. So it didn't take me long to go, huh, something feels off.
mhm,
Sadly, that's not the case for people that aren't in that process or in that, field. And so um it didn't take me long, but I still suffered and I still struggled and I still heard a lot of the things that you guys hear. But I remember sitting there thinking, that basket of laundry needs to be folded and
uh-huh,
kind of contemplating like, do I fold that laundry or do I try to go lay down and take a nap while my daughter is napping and rest so that I can go to work tomorrow, right? That I can do what I need to do tomorrow to keep my job or whatever I need to do. And that's not okay. Like I should
no,
be able to fold laundry and still be able to go to work the next day.
yeah,
But just sometimes you're just weighing, if I do this, can I do this one thing that is
mhm,
absolutely necessary to happen? Or do I need to rest from that, let that laundry sit there for another week until I feel like I've garnered up enough strength to do it?
to do it.
And so that's where I was. And then I found myself forgetting things that I had been spending a decade doing with medication, like prescribing for people, going, I don't even remember what that medicine does, having to go and look it up, having to go up looking like dosing instructions for it when I had been doing that for 10 years at that point, thinking that's not good.
Mm,
And then it being blamed. So I think the thing that I remember the most is that it was blamed on me having a 6-month-old who, at the time, was sleeping completely through the night. Like it wasn't like we were constantly up all night and like we were sleeping. I was
mhm,
getting rest and being blamed on, oh, it's just because you're a new mom and
yeah.
it's just part of it. Like it's just part of being mom. And I think one thing that I just didn't want to do is accept that answer and be like,
Mhm.
that doesn't add up to me.
No.
Sleeping 12 hours at night and waking up feeling exhausted and not being able to think about what I was doing in my job every day just doesn't add up to me because I have a 6-month-old who also sleeps through the night, right?
Abs-
I think that's the biggest issue too. Like I think there's systemic issues as far as like care guidelines and all of those, and I think they definitely need to be adjusted. Um, Whether that happens, I don't know, but I definitely think that needs to happen. But I also think as women, especially, we just kind of push through. We just get told
We
that that
do.
is what it is. And there really could be an underlying issue. And my goal is to always make sure that it is not your thyroid. Like you're not tired because your thyroid is off. Like maybe you're tired because you are going through something stressful, but it's not because of this over here. So I
Yes.
always want to rule that out as something that's exacerbating your symptoms. And a lot of times it actually helps the symptoms.
Mhm.
Um, to improve and to go away, So that way you can handle this emotional thing over here or whatever's going on in your life.
One of the big symptoms that I think with thyroid care is overwhelm. And
Sure.
that's one thing that I didn't realize until I got feeling better. And I was like, because I was always in this state of constant overwhelm, even when I was getting the crude oil treatment, like because I was still
Yeah.
having symptoms every day. Like, and it was this constant state of overwhelm. And I realize now, especially with my kids, because you treat my kids, we can say that on here, like I see it in them. And when I start seeing that symptom in them, I'm like, oh, you need to go get
Yeah.
your just,
Yeah.
we got
You
to
need
go
an
get
adjustment.
adjusted.
Yeah. 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 I mean, I think that's such a good point. And I don't know that not many people like point that out, but I think when you don't feel well. And there is just so much involved with having kids and working or being a spouse. Like there's just so much energy that has to go towards that. And especially if you want to do it really well, right?
Yes.
And I think when you feel horrible, let's just call it what it is, usually you feel horrible, it feels overwhelming to think like I have all these things I need to do, I want to do, whatever it might be, and I just don't feel like I can do them. Or like maybe you can do them, but it just feels like you're just constantly trying to battle. And so I do think that's such a really good point is that overwhelmed feeling um, of just, I don't know, it just feels like things get so out of
It,
control.
and there's no energy to go do it. So it's
Right.
overwhelming to look at it and go,
Yeah.
I
Exactly.
can't even do that. Like,
Yeah. Yeah.
so yeah, so what in your I wrote down some things while you were talking. I know one thing that I have heard you talk about and McCall talk about. McCall's the owner of Modern Thyroid Clinic. So if people don't know who we're talking about, that's who we're talking about is McCall McPherson. But what percentage of women do you think have a thyroid condition? Like, because I know there's a lot. Like, and it
Yeah.
seems like we are the ones that are brushed off and told to get over it. Just like you said, oh, you've just got kids. Oh, you've just got this. I heard that for
Yeah.
years. Um,
I think it's a lot, probably a lot more than we think, for
mhm,
sure. I definitely think it's a lot more than we think. I think if you have children, I think it's inevitable, honestly.
I do too.
And I think the older you get, the more likely it is. So I mean, I think it's probably more than even 50% of people. And I think the other thing is that it may not show up with all the symptoms, right? Like, and sometimes they're very subtle, very gradual.
Yep.
And maybe they do start out right after you have that newborn baby. And it's really difficult to flesh out like what is coming from what. But I think it's probably a lot more than we think. I do think if you have children, you need to be screening for it at any point. Um, you need to be screening for it. And then I think also that the older that you get, so anybody, to me, anybody above 40, especially women, could benefit from some thyroid replacement or some support in your thyroid at 40. Because once you start to go through like perimenopause
Oh
and get
gosh.
into those times, you're going to also see like that's a time where you naturally see hormone declining,
Hmm.
specifically sex hormones at that time, but also your thyroid. Um, and in order to maintain health and to maintain quality of life, to me, quality of life is so much more important than the quantity of your years, like who cares if you lived 85 years, but you were in the dumpster the whole
Miserable.
time, right? Like, who cares? But if you lived 65 years and you lived a full life, and so quality of life, I think, is the most significant thing. And I think thyroid number one should be at the top of everybody's list to make sure it's perfect. And then sex hormones like estrogen and progesterone and testosterone from there, and of course your adrenals too. So those are, I mean, over 40, I think you need to be looking for those things. If you're a mom, especially like even a mom of young kids, like I don't necessarily care what age your kids are. I think you need to be screening for those.
Yeah.
And I think if you don't feel good, I don't think you need to accept, oh, that's just the way it is because you're a mom as an answer, or
Yeah.
that's just the way it is because you own a business, or whatever it is that you're doing. I just don't feel like you should accept that because big emotional stress. Like having a baby is an emotional
Yeah.
stress. Raising children is often very emotional. Having a business, I mean, anything, right, that we go through, it can be very emotional, very taxing on us. That alone is going to push you at a higher risk for a thyroid issue. So I think it's a lot more, especially living in a modern day world. I think it's quite a bit more than we think. I think I've read some statistics, and this was probably a couple years ago, that I think there's not 100% on this, but it's like 10 million are diagnosed, but we think it's upwards of like at least 25 million that are undiagnosed. It's somewhere around there. And I may be saying that wrong, but I know it's a lot of women that are undiagnosed. And I probably think it's even more than that.
Well, I'm pretty sure that I went undiagnosed for a long time because looking back, I think mine
Mhm.
started in high school. And because I
Mhm.
started having problems with Epstein-Barr, like all these stupid things like started
Mhm.
happening, and just complete exhaustion would like hit
Mhm.
me and plow me over, and I'd be in bed for a week. Like
Yeah.
that's not a normal high school kid
Yeah.
thing, like so looking back, I
Exactly.
think mine started then, but all those years ago, they didn't even they're not looking at that stuff, you're not treating that
Well,
like
to be fair, I don't know that you expect it in a teenager.
no.
But I think we should start. I
I do
really
too.
do. I think mine started when I was probably 19, 20. And
Hmm.
I think about like I didn't find I mean I found out I had Hashimoto's like at 27. So I knew I had a Hashi, but it was very, very low grade, very mild. I was
Hmm.
able to really keep it controlled. And then life kind of got chaotic toward the end of my late 20s. And then when I first had kids, and I just kind of didn't, I don't know, there was just so much going on that wasn't what I thought about until I had my daughter. And I was like, wait a second, what am I doing? But I truly think I started seeing things show up or symptoms show up when I was, 19, 20, trying to
Yeah.
play a college sport. And um, I think it just unraveled everything from there. And I think, God, my 20s were spent like not feeling good at all.
Yep.
Like the prime probably of my life was spent not feeling very good at
Hmm.
all. Um, Anyway, I just think now we probably need to be screening even younger than we think. Being ahead of the game, I feel like especially the younger you are, the better off their quality of life is going to be if you can get ahead of that. Really.
Agreed. Agreed. Let's talk a little bit about medication use. One thing that you mentioned before we got on was the amount of people that are saying like you don't need
Yeah.
you don't need to use medicine for it. There's other ways around it. Now, you and I both know because I listened to the statistics too of what it really does for us and with the quality of life. But why don't you talk to them a little bit about that? Because
Yeah.
I'm totally on board with you. Obviously, my medication's sitting right here on my desk. Like I have it everywhere in my house.
Mine
Yep.
too. It's kind of sprinkled everywhere. Yeah, so I think there's a lot out there that says, "Oh, you don't need thyroid medication. It doesn't work for people." Really it boils down to like inflammation, or you just need this supplement to help with that. And I guess my thought process is yes, maybe if you catch this in like 2 months, and you're like 20 years old and you catch it so soon and you're able to catch that you have Hashimoto's and revert, like not, I don't ever say reverse, but you kind of put that into remission. Maybe you can stave off medication, if you catch it very, very early on, which I would say is actually very rare. Most
Yeah.
of what we see, especially at Modern Thyroid, is people have been dealing with this for decades, depending on their age, sometimes upwards of 20, 30 plus years. Like you mentioned, like some of them felt these symptoms in their 20s. Um, and so I just think at some point, especially in cases like Hashimoto's, which is an autoimmune attack on the gland, if you don't catch that super early on, the longer that goes, the function of your thyroid's going to be lost. And so basically at that point, what happens is you have, let's just say you've lost 20% of your function. Now you have 80% trying to make up the full 100. And it's not going to keep up. Like life is too demanding. The processes in our bodies rely on that T3, and it just can't keep up. And eventually you're going to start to see unraveling of metabolic function, cardiovascular function. And so that is one thing that we tend, Hashimoto's is the most common thing, and we tend to catch it about 5 to 10 years after its first onset. So at that point, we've gone 5, 10 years and we've started to lose function. So yes, you can reverse the Hashi. You can put that into remission, which does gain you great benefit, but I don't ever see the function of your thyroid, which is completely different, regain. And that is where medication can come in and be a really useful tool. The other thing is as you get older, into perimenopause, menopause, as I mentioned, there's a natural decline in hormone function. Thyroid is included in that. And in order to maintain quality of life, a lot of times we have to supplement to help that function get back to where it should be, to where physiologically everything just really needs to fire. I also think that because our our life, our world, what we deal with on a daily basis. We have so much information just thrown at us, right? And I think because of that, we are very stressed out.
Yeah.
And we a lot of times can't out lifestyle that stress. So when it comes to like conversion or whatever is going on in your thyroid, like a lot of times we just cannot out lifestyle it. And so medicine, I think, shouldn't be anything to be afraid of. Now I do think if you're using T4 only, I would run away. So if your clinician is only using that, then run away. But if they are open to balancing your hormones with both thyroid hormones and doing that very well and utilizing that appropriately, it can be an excellent tool to getting your quality of life back up to where you want it to be.
Yeah. I know now that I've been working for you, I can tell the moment that I'm off. It's the
Yes.
crazy, like, because I felt so crappy for so many years, and then now I'm optimized, and I know the moment, like, I'm in getting my blood done, and we're on a phone call because
Yeah.
it's not
And
okay
that's what we
anymore.
want. Like as a practice, we do a lot of the hard work in the first year.
Hmm.
And really, I would say it's anywhere between 9 to 18 months when you're kind of fully optimized and everything's where you want it. And what our goal is to get you back to what it feels like to feel good again.
Hmm.
And then when you deviate, because life will come at
Yep.
us,
Yep.
we will walk
Hormones.
through things. Yeah, you will go through transitions of perimenopause and menopause if you're like starting this at like 25, like eventually like there's gonna be the ebbs and flows of life that are gonna like throw you off a little. And a lot of times we need some adjusting, some tweaking. Um, and so, like, if you're like, hey, I feel really good, everything, this is what I look like when I feel good, and then you deviate 10%, we don't want you to unravel all the way back to where you were when you were beginning. Like, we want to catch it at like 10% and quickly get you back on
Hmm.
the path. And so that's our goal is get you back to that point so that when you deviate a little, you feel it. You're like, I've noticed I feel off.
Hmm.
It's not as bad as it has been in the past, but something's off and we do some tweaking. And a lot of times, like you depending on what it is, but a lot of times, like within a couple of weeks, you're kind of more back on track. And then kind of going back to your where you want to be. But yeah, we want to get you back to where you're feeling good. And that's our goal. I can't speak for like other practices, but that's ultimately what we want for you
No,
guys.
you guys are so good at that because I did even when I send a lot of people to you, we've talked about that, and I tell them I'm like, you need to dedicate a year, which is
Yeah.
every 3 months. You're not seeing, it's not
Right.
every six
Right.
weeks. It's like
Exactly.
every 3 months. So you're seeing you 4 times in that year, doing adjustments, doing tweaking, doing all the things. And
Yeah.
usually within that year's time, you're pretty dang close to where you want to be. I
Yep.
think I went a little bit longer than that, but I had been out of whack for so long that
Right. Right.
and then we had hormones to deal with in the middle of
Sure.
all that. So then we're
Sure.
not we're not just doing thyroid now. We got all the other hormones
Yeah.
going on because I'm in that lovely stage of
Yeah.
all the things. Let's talk a little bit about hormones, women's hormones, estrogen, progesterone, and how that plays into all of this and how important to me. I've had people actually tell me that they have been told that they shouldn't supplement and because it causes health risks down the road. And I'm just like, oh my, let's take a big deep
Yeah.
breath here. Like,
Yeah. There was a study done in the early 2000s called the Women's Health Initiative, and I really think like that decade of women, um, or not decade, generation, I guess is a better term, but that generation of women that followed those guidelines was set to a huge disservice, like
they were.
huge disadvantage. And that study was very poorly done. They did come out, I think maybe 2021 or 2022, and said, hey, this study is actually really bad. Like we confess like it was a very poorly done study. That study showed that they used very like synthetic estrogens, synthetic progestins, conjugated equine estrogen, which is from horse urine. We don't look anything like horses, right? And so their structures of those hormones are very different than ours. But what that study showed was, that it places you at higher risk for strokes or breast cancer or all the results were. Like it's all, I mean, stroke, heart disease, breast cancer, those are the big ones. but there was very specific things about it. And what they found was that progestins actually are the ones that place you at higher risk. And so when they found all that, they just kind of bundled every hormone into it instead of saying a synthetic progesterone type supplement, which is going to be oh, what's the name of it? I think it's Prim Pro. I don't ever
I
use
think
it.
you're right. I
I
think
think it's
that's,
Prim Pro, but
yeah.
anyway, they just lumped it all in, and they said estrogen's bad, progesterone's bad, like they're all bad. Don't use them. And so there's a generation of women that huge disadvantage.
Hmm.
I think the younger you can supplement, like if you're showing signs of that hormone is in decline, the younger or the earlier you can supplement, the better off you're going to be, the better your quality of life is going to be. Um, the biggest thing that women worry about is what about breast cancer? And there's actually some newer studies coming out. There was a huge study done, 10 million women in 2024. I think it was like April of 2024. It was a massive study. They followed these women for 14 or 15 years. It was a very long time. And they had women on hormones, not on hormones. And what they found was that the women that were on hormones, it doesn't take your risk to zero. Like I'm not gonna say anything has zero risk, right?
Yeah.
Like
No.
everything comes with at least a risk, and you always have to weigh that for yourself. But what they found is that so if this woman was diagnosed with breast cancer, she actually did have a better outcome than the woman not on hormones going into it. Because they keep you, they're like a protective shield.
Yeah.
So you think about like 20-year-olds don't typically have heart attacks, right? Like I don't know that I've ever had a 20-year-old woman have a heart attack,
Nope.
seen a 65-year-old woman have a heart attack, right? So those are like a protective, youthful, quality of life giving hormone replacement. I mean, are really beneficial in my opinion. And I think the earlier you can get them on board, just the better quality of life you're going to have.
Yep.
And so breast cancer is always the big one that I get a question about. I have had women with a history of breast cancer, and ultimately, at the end of the day, like we have to weigh the risks, but for most of them, the quality of life outweighs the risk all the time. Um,
I'll say it.
it's
My
very
mom,
individualized.
yeah, my aunt has had breast cancer. It's my mom's twin sister, and I would treat day over, like I wouldn't even consider not having,
Sure. Yes.
because to
Yeah.
me, it's worth it. Like the quality of
Absolutely.
life is worth
And
it.
like I said, like if you have 5 more years and they're as life-giving as they can give, that's going to far outweigh than if you have 20 more years and they're just, you feel like garbage during them all and it's a
Yep.
struggle the whole time. Because like life is already a big struggle. Like we
Mhm.
do go through a lot when we're here on Earth. And um this just shouldn't be, this is just something that's so easy to mitigate in a
It
lot of
is.
cases. It
Yeah.
really is. And so, um, I also think like the number one killer of Americans is heart disease.
Mhm.
And when you lose those protective hormones, that's going to place you at a much higher risk for that. Like that
Mhm.
is what kills most of us. And so anything that you can do to help reduce your risk, like I said, I don't think it takes you to zero. I think there are so many factors that go into even heart disease and breast cancer, but we know these things about these hormones that do provide that protective shield for you.
Mhm.
And I think working with a clinician that really understands that, we're at Modern Thyroid, like we are not here to supra physiologically replace you. Like we don't need your estrogen levels to be that of what a pregnant woman would be. We know that there are certain levels that you need to be in order for you to maintain your health and quality of life when you are looking at replacement. So that is our goal, is where are those levels? And let's keep you there. We also want to make sure that we're using really safe methods. So typically I recommend like avoid oral estrogen at all costs. That is the one that's going to drive up risk. It has the highest risk associated with it. So using things like topicals are going to be very effective a lot of the times and much, much safer. So
Mhm.
it is something we utilize a lot. It is something that I mean, I am on hormone replacement therapy. I take thyroid and progesterone, which that is probably the most common, that and low testosterone are the most common hormone imbalances that a thyroid patient will experience,
Mhm.
especially if they're premenopausal. So I am on it. and life changing
Yes.
quickly is kind of the thing. Like low progesterone is typically associated with a lot of anxiety and um, poor sleep issues, irritability. Kind of what happens is patients kind of get ragey and like their marriages are kind of at stake because like all of a sudden they're just raging all over the place,
Mhm.
and progesterone can be so giving and life-giving for that and quickly. Like you can typically see those symptoms start to subside within a week. And so I don't know. I think the earlier you can intervene, the better off. Why struggle?
Why?
And just find somebody who's willing to look into that deeper for you.
Yeah, I know I just went through a major like to me I've always had high estrogen and
Yeah.
mine dumped like
Ah,
for whatever reason like but I remember like the feeling the anxiety like not sleeping just the not
yeah,
sleeping alone was a toll on my whole mental like not being able to fall asleep and waking up at 3 o'clock and then you're up at 4 and then you're up at like at 5 you're like I
yeah,
might as well just get up like this is ridiculous
yeah,
to me, the quality of life from just adding in some estrogen to my life, like,
sure.
is
Uh,
I can't
it,
imagine not.
yeah.
Like,
And I did speak a lot about it, progesterone, but estrogen, I mean, that's what drives some of your brain function.
mhm.
It does have quite a bit of protective barrier for heart disease. It's so good for your bones. So, I think, and everybody's different in what they decide to do. And
Mhm.
if they feel like the risk is not worth it, absolutely, that's your choice, right? But I think about, if you don't replace, the likelihood that you're going to go on a medication to treat osteoporosis is really high.
Yep.
The likelihood that you're going to start to see insulin resistance and blood sugar dysregulation, whether that's from thyroid or even as you go through menopause, you're going to start to see a lot of those changes. And then now we need blood sugar and diabetic management, right? So
Mhm.
if we can take supplementation for hormones and avoid potentially the need for 10, 12, 15 meds just
Mhm.
to offset all the things that happen, we're not postmenopausal, we're not deficient in Ambien, we're deficient in hormones,
Yep.
deficient in progesterone, we're deficient in estrogen, testosterone, we're not deficient in Xanax or Ambien. And that's what we tell all our patients. Like,
Yeah.
you're not deficient in those things, right? And so a lot of times for women, that is the most common thing I hear postmenopausally outside of hot flashes is their sleep is horrible.
Sleep is
Um,
terrible.
and it a lot of times can be fixed with hormone replacement therapy.
Mhm.
And you're doing something that's going to create a more youthfulness in your body. Not that you're going to like be 25, that's not what I'm saying, but like you're going to have what the hormones that protect and provide that
Mhm.
shield for you.
Yeah.
Uh, to help your quality of life just be that much better.
I think it makes such a huge difference. And I don't know. I just think women need to be informed and have the
Sure.
opportunity, just like you say, like, so maybe you think, oh, because breast cancer is so high, I don't want to risk it. That's totally fine, but at least know what your options are and know that.
I even had patients who, while they had active breast cancer, right? Like we didn't, they have an estrogen positive tumor. Like, of course, we didn't do it, but I've had a few that the second they could had estrogen back in, they did it, and that's so patient dependent,
It
but
is. Yeah.
they, a lot of our patients just really value the quality of their life, and
Mhm.
it can provide that so well, even with like a history of breast cancer. And that's, like I said, that's a very patient dependent scenario.
Mhm.
We do have to weigh all of that for you, but most women choose that as
So
one
long
of your.
term, I'm in this, I'm in my 50s here, like long
Mhm.
term, do you still
Mhm.
supplement
So,
clear up into
yeah, so for a long time it was like, oh, a woman reaches like 65, you got to take them off all their hormones. And
uh-huh.
we're actually starting to fall, like not go back to that anymore. We're actually starting to
Good.
see that big study that I was mentioning took women into like their 70s and 80s, and they continued hormone replacement after that point. I believe it also looked at women who hadn't been on hormones since they went through menopause and started them at 65 as well, even they saw benefit and they
Yeah.
hadn't had hormones in at least 10 plus years, you know?
Yeah.
So used to, the guideline was to take hormones, people off hormones after, I believe it was 65. I don't know that I ever did. I don't know that I ever followed that because like, why would, if you're feeling good,
Why would you
take
do
away
that?
something that's helping you feel good, right?
Yeah.
But I do know the guideline was out there. I think they've actually pulled that guideline away completely, and now you just continue them on until basically you pass away. Um, but yeah, I mean, we used to just take them away, and I'm like, why?
Why?
Like, would you replace? Because once they lose that, it's not like you're ever going to reproduce them again. So it's not like it kicks you into producing those hormones
No.
again. And 65 and up is like I not that it's too late. I think it's always like the time is always now. Like you can always go to the gym today. You can always
Yes.
do a dietary change today. You can always add hormones today.
Yeah.
Um, I don't like we've had so many women start hormones after 65 because of this new study and see changes in their quality of life and see changes in their weight and their bones and their ability to actually go and do things. And so I don't know that you have to wait. Um, and I think there's always individual cases, right? But for the most part, if you're a good constitution, like there's really no reason that you couldn't start hormones even after 65. So
Yeah.
I think the earlier the better, but I don't ever think it's too late either.
Yeah. Yeah, I've been seeing a lot of that people are like, why would you do that? My biggest thing, my thing right now that I am watching happen in my world is my mother-in-law, and I'm watching her at 95, who has never had a hormone replacement ever, has never done anything. And the things that are going on in her life right now, I'm just like, oh my gosh, I think I would have rather lived to 85. And
Sure.
she had a meltdown the other day because she's been having a lot of UTIs and she's lost all of her bowel control, and they wanted her to use vaginal estrogen, and she was afraid she's going to get cancer at 95, and we were like
You're like, you've lived a long life at that point. I
yeah, but we're
think it's
seeing
well
that.
worth the risk.
Yeah,
Like
exactly. And
I
the
would say
brain,
her chances of dying from a UTI versus cancer is probably much, much higher.
much higher, much higher. And the other thing is the brain decline. I think with the inflammation in the body, not treating the inflammation in the body, not doing all those things. I don't know, I'm no expert here on the Alzheimer's and dementia, but to me it seems like an inflammation issue that we got going on here
I mean,
that's
I think they're labeling it now type 3 diabetes.
mm-hmm,
Um, yeah, I mean, I think blood sugar dysregulation is huge.
mm-hmm,
And I think as you go through perimenopause and menopause, and then you couple that with a thyroid issue, right? Like your blood sugar starts to dysregulate and you start to see more insulin resistance in those times. And then if we leave it untreated, it usually turns into diabetes and then all of the inflammatory things that come with diabetes, right? So I do think it's a combo of inflammation and a lack of hormones and then toxins, like all the toxins that we're exposed to on a daily basis, but which then create more inflammation. So it's
yes,
kind of all connected. The hormone, like estrogen specifically, drives the function of your brain. So a lot of women like postmenopausally, like they can't think. And
yep,
that can be from thyroid, and that can be from estrogen, and that can be from adrenals.
yep,
So a lot of times you have all three
all
of
three.
those menopausally, um, but they all drive your function in some capacity. And then the thing about I was just kind of thinking right now as we were talking about like that, you talk about cholesterol and a lot of times your cholesterol goes up, so then you get put on cholesterol medicine, which that places you at higher risk for diabetes and Alzheimer's. So, I don't know, hormones I find to be incredibly beneficial to
And
prevent and reducing risk.
yeah, and they seem to take away a lot of the other risks. To me, when you start looking at the
Sure.
whole picture, I
Yeah.
know even before I started getting my thyroid taken care of the right way, we're going to say it that way, they wanted me on blood pressure medicine, they wanted me on cholesterol medicine. And I was like, no, this isn't, I knew in my gut this was not the problem.
Yeah.
This
Yeah.
was not it. Like there was
That's what
something
I'm
else
saying. Like
driving it. Yeah.
medicine can be so effective in helping us reduce that risk of needing blood pressure and cholesterol meds
Mhm.
and diabetic meds. And I think especially the earlier you can intervene, the better. But yeah, I mean, I think both of those things, perimenopause, menopause, and a thyroid issue, you're
Mhm.
just going to start to see an unraveling of your health. Some people it's much more rapid, and some people it's like slower and like a slower decline, but still you're going to see it, and eventually it's just going to all catch up to you, and
Yes.
then it's, I do think potentially that there are some times where it's a point of no return. The longer you go and the longer you get replaced, especially the older you get. So more
Yeah.
the older you get, I think sometimes there's like, I don't know. I think sometimes you can reach that point of no return at a certain age,
Yeah.
usually like in your 70s, 80s. But I still would be trying. I would
I
try at
absolutely.
any point, to see like even if I didn't completely take your A1C from a 7 to a perfect, could we at least lower it, right? Like,
Yeah.
so while we may not be able to completely reverse the diabetic state, like we could at least improve it, in my
Could totally
opinion. So
improve it.
I don't know. I just think sometimes the older you get, like we're talking like older, 70s,
Hmm.
80s, 90s. I still think you deserve to feel good up until the day you die,
Me too.
but
I know I saw a
but
study the other day where they were saying you shouldn't treat elderly people for thyroid conditions anymore. And I just wanted to bang my head against the wall because I'm like, so she's lived to 90. She doesn't deserve to feel good at 90
right,
anymore.
right. I One of my oldest patients was 95, and
Oh,
this was at another practice. Actually, I don't my probably my oldest patient is 80 at Modern Thyroid, but I remember she was so exhausted, and really good health, like
hmm.
really good health. Her memory was so sharp, but she would just be talking to you and then she'd just fall asleep. And I remember thinking, let's just try this. Like,
Yeah.
let's just try like the tiniest pinch of T3. And her daughter came back. I saw both her and her daughter came back like a few weeks later and was like, you wouldn't believe it. She's like buzzing around, taking the fence, like doing all these things that, anyway, so I thought just goes to show like they probably would have put her in a home and thought she had dementia or something because she was falling asleep, but
Sleep.
her daughter just didn't stand for that and was like, "No, let's
Mhm.
just try to figure this out." And that was literally it. She just needed her thyroid was a little bit off, and we just adjusted it a little bit, and here we go. And I don't remember
Gosh.
when she passed away, but the rest of her years were really great. And, you
I
know,
think we all deserve to feel good. I don't care
yeah,
what age you are. I don't care how old you are.
no.
Do you have time to talk about T3 or not T3, GLP ones for a minute? Do you
Yeah,
have time to talk about
yeah.
those for a minute? Because I
Speaking of
think,
like reducing risk of Alzheimer's and inflammation, like
ugh,
that's another huge one. And
you need
um,
to tell my husband that. I've been trying to tell him.
yeah,
I'm like, can you just microdose it? Like, let's just do a little bit.
yeah,
Like,
like
this is
I
his
mean,
mom that we're talking about his
there's
mom, the 95-year-old lady with dementia. I'm like,
yeah, we have some research studies
ooh,
actually.
send me
Um,
some studies because I want to give him to him because
there
I
are
was
they?
trying to talk to him about it the other day and he doesn't need the weight loss part of it. I'm like, you need the inflammation part of
No,
it.
he
Like,
needs like a quarter, not even a quarter, probably. Like he could probably get away with like a tenth to a quarter of a dose just to reduce his risk.
uh-huh.
Let's see where it is. I saw it
Yeah,
the other day.
I need him to I was like, "Oh my gosh, I was trying to talk to him about it
It
the other day." He's like, "There's no
is,
significant studies." And I'm like, "I'm sure there has to be a study out there on
um,
Alzheimer's rich and GLP-1s
I found
like,
one the other day that showed a potential reduction of 40% of progression in Alzheimer's.
oh wow.
Reduction in the progression. Not, I don't think, I think, like I said, I think sometimes in certain parts of your body, you're going to reach a point of no return, but could you slow it down? Could you improve it a little? Like it may not go away completely, but could we at least extend your life a little, or
Yes.
extend how quickly it progresses? I'll see if I can find it, but I'm pretty sure it was they studied it in Alzheimer's patients and saw that it could reduce the progression by 40%, which
Wow.
Alzheimer's medication is not great. Um, I remember using it quite a bit in primary care, and I never saw it work. Like
No.
people would start it and come in 3 months later, and you'd evaluate them, and they'd be progressively worse. And
Yep.
then eventually, like there's only so high you can go on dosing, and it just doesn't
Doesn't
help.
seem to do much. No.
And I also think like if you get it on board before you have Alzheimer's, you're going to reduce your risk of that. So if you have a strong family history of heart disease, diabetes, Alzheimer's, dementia, I mean, any of those metabolic disease
Mhm.
processes, you're going to reduce your risk by about 20%, in my opinion. It kind of on average. I think certain
Yeah.
things are going to be a little bit more, but on average, you're going to reduce your risk of those by 20%, which that like heart disease is what kills my family. Everybody like a male in my family has died at the age of 65. Um and so why wouldn't you utilize something that has the power at just a small amount to help reduce that risk?
Mhm.
And I'm also big in reality, right? Like I think we have this idea that we should live our life perfectly, and if we're anything short of that, then we're doing something wrong, or and I think it creates this mental health spiral of, well, I can't do it perfectly, so why do it at all?
Yeah.
I feel like we're kind of an all or nothing. And so if injecting a small amount of a GLP helps reduce your risk of that, but also allows you to live your life in a very balanced way, a very enjoyable way where you can still eat well, but also still kind of enjoy the fun of life.
Yes.
Why wouldn't you
Why
if that
wouldn't
helps you
you?
maintain your weight? And these are things that we see even outside of weight loss. Um, so a reduction of inflammation, we have actually seen, I actually had a patient a couple months ago. She had a CRP. So CRP is a non-specific inflammatory marker of about a 40. We want that level to be as low as possible. Optimal is below 1. The higher it goes, the more at risk we are for some sort of a cardiovascular event.
Mhm.
And you're very inflamed. And it doesn't tell me where that inflammation is, just that you are. She was 20, I think she's 28 or 29.
Wow.
So 40 CRP chronic. Like we had been dealing, this wasn't just like a one-time thing where she got sick and it was really high. Like it said it was a chronic number that I had been seeing with her. She started within 1 week of a GLP. So she happened to get her labs done like the week after she injected it, dropped it to a 17.
Oh my
One
gosh.
injection, hadn't lost a single pound. She was extremely sensitive to it. So I think she injected like 3 units, which
Mm.
typical starting dose is about the recommended starting dose is about 25
20.
units. That's
Yeah.
not what we recommend, but that's what the guidelines say to start with.
Mhm.
3 units dropped it in half. So she just reduced her risk of having a heart attack pretty immediately by about half, by
Yeah.
50% in a week. So I think that they have a very bad stigma. I think there's a lot in the media calling out these things. And personally, I think it's because I think Big Pharma knows it's a landmine. Like they have a gold on their hands. And I don't want to get like into all of that stuff, but I just think they know that. And so I think there's just a lot in the media that's making people really scared of these,
Yeah.
or saying that people are using them as a crutch. And if you have a thyroid issue, I always like, there is no such thing as a crutch, in my opinion, because you deal with so much metabolic unraveling that in order to get back to the point where have a healthy metabolism, a healthy blood sugar, it could take decades. And nobody has the patience to try to stick around for 20 years to see if their blood sugar budges like point
We'll see
1
if
in the
our
next,
A1C will go down
right?
one
Like
point. Like,
we don't have that type of patience and we
mm,
get frustrated. That's super frustrating. Like I get it. And so these are just things that they help speed that process up
mhm.
while providing tremendous benefit in other areas too.
The one thing that I have noticed for me is the inflammation reduction. Holy shit, will
Yeah.
just like it's a holy shit moment. Like, and I even with all of my estrogen and all of that, my inflammation for whatever reason, of course, I had been doing really low dose of the
Mhm.
GLP-1. I was still taking it, but I had cut it in half and done a lot of things. And I noticed I had to go back up a little bit, which doesn't hurt my feelings at all. I don't care. That's why we compound it so we can like
Yeah.
do the little
Yeah.
steps up, like
I mean, personalize it, right?
right, like
Good to
whatever
you.
works. But the inflammation thing, and to be able to live my life and not worry about it, having a thyroid condition for 32 years, like I couldn't
Mhm.
even look at a freaking candy corn at Halloween and even think
Yeah.
about eating
Think
that
about
thing.
it.
Like, yeah. And
Didn't
now
even
it's
think
like,
about it.
I don't worry about it that much. I don't, it's
Yeah.
taken away that fear of
Yeah.
regaining weight or and to do what I've done in the last year and a half on a GLP-1 would not have been possible before. It wouldn't have happened. Like, so I people ask me all the time, they asked me about taking it. They think it's such a high risk to take it. And I'm like, I can't imagine not taking it because we've just
Yeah,
cut heart disease. What is it? 40%, I think is what you said, or 50%. I know
20.
there's,
It's about 20% for heart, and then I mean you can slow your progression of Alzheimer's and 40 by 40%. Like if you
yeah.
already have Alzheimer's, which is typically pretty progressive.
And then your insulin, blood
Yeah,
sugar regulation, like there are so
right.
many positives to just being
Yeah,
on this medication. And we've kind of already talked about all of the other things with all the hormone. Like, I
yeah.
mean, this
I
thing alone to me was a game changer.
absolutely.
This was a game
I think
changer.
this is probably the biggest thing that we'll see. I mean, I agree wholeheartedly with McCall that I think these are the biggest things that we'll see in my lifetime with
Mm.
medicine.
Yeah.
Um, and you know, I don't know. I like if you are able to live your life, live in the that more balanced state of
Mhm.
not too extreme with your diet, but you can still go and enjoy like a little bit of like a Christmas pie or something, right? Like there's just things in life that bring a lot of joy, and food is one of those for a lot of people. And I'm not saying like we just go hog wild and eat whatever
No.
we want. I'm just saying that when special circumstances come up, people on GLPs can go and eat that with peace of mind, going, it is worth it. I can enjoy this and I can also be able to not have the whole pie,
Yeah.
like I can enjoy my small piece and know that I'm not going to be up 10 pounds the next day, but
No.
also know that I'm not going to go and just eat the whole pie, right?
Yep.
So I think that's probably the biggest thing outside of
Hmm.
inflammation that people have noticed is the food noise and that
Oh, the food noise
being
is huge.
free of the hold that food can have on you.
Hmm.
Because most of us, I mean, if you're 30 and up, you lived in diet culture,
Yep.
where it was eat less, move more, and you need to look stick figure thin, and there's a lot of people that have a messed up relationship with food because of that,
Hmm.
and
Oh,
I've
I
seen it
mean,
break the chains of that,
hmm.
even in my own self, where like I used to be ravenous where I
Hmm.
would just constantly eat, and then I would beat myself up going, why can't you control yourself, and all these things, right? Like those are bad for you, and I get on them. I have Hashimoto's. They help me maintain my inflammation really well, um but they also help me have control over what I put in my mouth, um and to not feel like food rules me. So those are, to me, like I said, my family dies of heart disease. Anything I can do to help at least reduce the risk, because I want to be around as long as I can. I want to see my kids grow up. I want to see them get married. Like I
Yeah.
want to see all those things happen for them. So anything I can do, and if it's available and if I can afford it, I'm going to do it, you
Yep.
know? Um, but these are things that we see even outside of weight loss. So a lot of people say, oh, it's because you lost 50 pounds that you're less inflamed. It's actually not. These things happen long before you see your first
Yeah.
pound of weight lost. And I think because of the way that we approach it, we do quite a bit of microdosing. Most of our patients don't lose weight until at least month 3, but they notice it within 1 to 2 weeks of their
Yep.
injection. So they're really cool. But I think too, personalization and microdosing is the game changer,
Yep.
because I do think the dose makes the poison with them. And I think if you do increase or do too large of a dose, yes, you're going to see all those bad side effects.
Yeah.
But slowly allowing your body to adjust it, staying at the lowest dose that you need to for as long as possible. So if you're trying to lose weight, if you're still losing weight on that dose, there's no reason to go up, right?
Yep.
So the lower your dose is and the longer you give your body the time to adjust, the lower your risk for any of those really harmful side effects
Yep.
that we see. That's the way our clinic approaches
Well,
it.
and I tell people too, I have felt great on it. I don't really
Yeah.
have, I felt great on it. If I didn't, I wouldn't do it. Do you know what I mean? It's like, because
It-
I'm feeling good to me is the priority.
yeah.
Like, so
Yeah.
to me, that's what I tell people. Like, and there's the medications too. Like, there's the semaglutide. I did not feel good on that one. That one was
Yeah.
not and I'm
Not a
finding
winner.
that with a lot of people. Yeah, I'm finding that with a lot of
Yeah.
people. In fact, I remember doing a podcast or something with McCall, and I told her I was doing semaglutide and I'd been throwing up, and I was like on the smallest dose, like I couldn't even get. And she's
Yeah.
like, why, Gina? She's like, there's other ones. And I'm like, oh, you're right. There is. Like,
Yeah,
there's other ways to
that's
do it.
me. I don't tolerate semaglutide at all.
Nope.
Like I can tolerate a very small amount of it, but if I try to go up even a unit, I don't feel well with it. And that's I do think there are those people out there, but I've since switched to tirzepatide,
Yep.
which is the other one. It's a combo, and I've had a single issue.
I
So
haven't either.
and I mean, but that's just the thing I would see. And that does happen. And I do think sometimes it's just not the one for you and there
Yep.
are other options. But most people do really well on semaglutide. It's about 85% that I see do pretty well. And then there's
Yep.
like this 15, maybe 20% the more that we use them that they need tirzepatide. And the downside of tirzepatide is that it's a little more
It
expensive.
is. Yeah, it is a little more pricey.
And maybe it won't be that way forever, but it is for now.
Yeah.
But it's an excellent one.
But if you can do the smaller dose too and have it
Sure.
last longer, like to me, there's ways around that.
Mhm.
There's you can buy
Absolutely.
the monthly dose and then just get it. And that's what
Right
I
there.
do is just buy their
Yep.
monthly dose, but then I spread it out over 3 months
2, 3 months.
or whatever it
Yeah.
lasts, depending
Yeah.
on which dose
Yeah.
I'm doing. But yeah, there's ways around it. So, but it's totally worth it if you can do it. Like it's totally worth
Oh, yeah. I would agree. And
the
I think the consensus among most people is, I've had a lot of patients that have fear around them and are very against them. And we try all these other things, right? We try it, we try it, we try it, and then eventually they give in and they're like, I really wish I would have done this earlier.
yeah.
Um, and that's just kind of the consensus across the board. So,
I even had a lot of people at first like, I can't believe you're doing that. That's going to be another, my favorite thing that somebody said to me was that's going to be another Finnegan failure of all times. And I'm like, oh my gosh, we're not even in the
no,
same
I
ballpark.
actually think that mainstream is starting to even come around to the idea of microdosing.
Yes.
So it was kind of more of an integrative approach, and I think even more people across the country, like mainstream wise, are going to be using it
I
too.
do too. I think it's going to become the thing. The microdosing to me is the
Yeah.
absolute way to go. If you can do the
Yeah.
smaller doses, like the smaller the better. To me, with anything that you do, like the smaller the
Yeah.
better. Like we want to feel
Yeah.
good, but
And
whatever it
and
takes
I
to
I do want to put this out there too. I think when you're losing weight, I think microdosing doesn't always yield that.
exactly.
Um, and so there is kind of that special circumstance of like, yes, you may be inflamed, but you also need to lose weight. And the microdose just doesn't typically bring that result. So
No.
typically those are the patients that need higher doses. And then usually, like in my practice, we always kind of go into it with the idea of like, let's get off of this, right? Like, I want you to be able to get off of this if you want to. Most people, once they reach a point where they're like, okay, I'm at my goal weight, what do we start to do? We start to wean them down. They usually come around and they're like, I don't want to get off of this. Like, my
Mhm.
inflammation is controlled too well with this. I feel too good with this. How do we microdose? So that's usually the trajectory is that we have to bump it up in order to be able to lose the weight. So if there is that need, that microdoses don't always yield that.
Yes.
But you can always microdose in the future once you bring and that looks different for everybody. Like
I've
I have
noticed that.
patients that microdose like all year and they do a little bit all year. I've had some that will do like once a quarter. So they'll like, or every other quarter, like they'll inject for 3 months, take a break, inject for 3 months, take a break. Some go every 2 weeks, some go every month. Like I've seen all kinds of microdosing options. And to me, it's just what do you feel like works best for you? Because
Yep.
we're all different. We're all created differently and respond differently. So some people need it every day. I've had some that they will inject like October to March, and then
Really?
or like October to February, and then they'll take a break, and then they'll start it in the summer, and then they'll take a little break, and then they'll start over in October, just because those are like the big times when people travel and
Mhm.
you have sweet season and candy season coming up. So anyway, it looks different for everybody in that way too. But
I think so too, because I've tried doing it a few different ways and I seem to go back to the every other week or every
yeah,
like I just kind of
yeah.
like
I
I just
think
feel my body
I think
out,
that
like
for
whatever. I've
me,
gotten
I
really
mean,
good.
I'm usually like an every other weeker. I
Yeah.
go probably 10 days and then I'm like, I kind of feel a little puffy. Um,
Yeah.
let's just inject, and then I go about 10 days, and then here we go. But
I did go back to my twice a week after this last like big flare up. I was
yeah.
like, okay, we're gonna
I
go
mean, I
back
think
to
sometimes, I mean, I think that option's there too. Like if you
yeah,
kind of flare up, and like I said, sometimes we go through something stressful or life comes at us and or we travel and it's like, all right, let's get this down and then we can kind of space it back out again.
yeah,
So
because I felt so puffy. Yeah, that
it
was
can
not,
be
I was like,
so
oh, I
tailored.
remember why we
Yeah.
do this.
I think it's tailored to every individual. I really feel like there's like a select few people who don't need to use these. Usually they have a really aggressive form of cancer. Outside of that, I think pretty much everybody could find benefit in some capacity.
Yeah,
So
I think they
really
are a
cool.
game changer. I wish more people could see the game changer because
Yeah.
I think they're a game changer. They've been a game changer for me. I'm like, I wouldn't be sitting here in the shirt I'm wearing right now. Like
Yeah.
I just don't think even with all of the thyroid care and all of that,
Right.
there was just
Exactly.
years of undoing of
Mhm.
like I just felt that metabolic undoing had to happen. And that's the other thing I
Yeah.
tell people too when they ask me why do you stay on it? I'm like, because I am still medically, I'm undoing a lot of years of,
Sure.
and I'm fine with
I
that. I
I
don't have
would
a problem
agree.
with any of
Yeah,
it.
I think that's the thing too, is that, logically in my mind, if I gained weight because my thyroid's off, like fixing my thyroid should yield weight loss, but sadly that's not the way it works.
Yes.
And it is probably, McCall talks about this a lot because she's been doing this a little longer than I have, and she talks about how like that would be the very last thing that people could see get better, maybe never get better.
Maybe
And this
never.
has been an opportunity for us as a practice to be able to get these people who've never been able to lose weight, even when their thyroid and everything was perfect, to be able to help them lose that weight and finally get it off. And you're right, like you do typically, most people, I think, go at least 5 years before they ever get their thyroid condition to diagnosed. And in that 5 years, things are changing, things
Oh,
are getting disrupted.
yeah.
And it doesn't just change overnight just because your thyroid is now perfect. There's a lot of work that has to go into that. Most of us aren't willing to take 20 years to reverse the 5 years of damage, but
No.
they'll do it in like 2 years, a year and a half, a year,
Mhm.
whatever, however long it takes, but they'll do it in that time frame. And you're right. I think the longer you go, a lot of times the longer that healing's going to take.
Just yeah, and I noticed that I was thinking back to before all of this care. I remember I did actually go in. It took me forever and I lost 32 pounds. It took forever, literally. Like I think
Yeah.
it was like 9 months or 10, like it was, and I had to be so anal about everything that went in my mouth, like everything that I did. And then I remember I decided that I was really missing potatoes. I literally added back potatoes like once a week into my life. Like that's literally like the only thing that changed. And I remember I gained it all back and 10 pounds more. Like it was the craziest, like it didn't
Yeah.
take anything at all to like set it all off again. So I was like, when this all came around, I was like, oh no, there's wisdom in all of this for
Sure.
sure. Like,
Right. Like, gosh, especially as women, like if we could have just a little security blanket for
mhm,
things that create a confidence in us, like why not use them?
why
I
not
mean,
use it? Why not use it?
especially when they have such a high safety profile, they really
They
do.
really do.
Don't really have a lot of side effects.
No.
I think I mean, I think there's bad ways to do it, but I think, gosh, they have so many potential benefits.
I think so too. I think the benefits far outweigh for most people. I think you have to weigh it out in your own mind and
Absolutely.
decide what you want to do. But yeah, I think for most people, the benefits
Absolutely.
far outweigh. Well, I appreciate you today, Hillary. Is there anything else you want to say before we?
Um, I guess probably the biggest thing is, if you're not feeling right, not feeling good, and everybody's telling you you're normal, don't accept that and try to find someone who will at least look at things a different way for you
Yeah.
and try to see if they can't figure out a different way of treating you or whatever it might be. So I guess don't accept normal as an answer.
Yeah. And normal feeling tired and overwhelmed and your hair falling out is not normal. There's nothing
No,
normal
or
about any
like
of
the
that. So
last third of your eyebrows, like when in the history, like that's just not a
not
common
normal. And for
symptom,
people
right?
to
And
tell you that it is
yeah, that's not
no,
normal. That's definitely not normal. So
no.
just don't accept normal as an answer, in my opinion.
Yep.
So
So, um, we'll put the link to Modern Thyroid Clinic and you can request to see Hillary because she's freaking amazing. So thank you, Hillary, so much for
Everybody's there.
today.
Everybody there is great as well.
Everybody there is
So,
great. I haven't met
but
anybody that is
also
like,
depending on what state you're in,
oh yes.
it may just be dependent on that too. But everybody is great there. I would love if they did come to see me, obviously, but
Yes.
I may not be in a specific state. I don't know. Do you see people in different states
I
or?
do. We see people from all over, so it just kind of
Good.
depends. Yeah.
Yeah, I
So
mean, I have, gosh, I think I have 30 states. So I have most of the
you
country.
have most of them. I think I was trying to think who I think we're in
Yeah.
Colorado. I'm trying to think who's in this group. Colorado. We have some from Canada in here. That's always been a challenge with Canada.
It is. I mean, and we do consults, but that requires you having somebody who's willing to work with you in that way, and that's hard. That's
It
really,
is
really
hard
hard.
because most of
Um,
them out there do not want to do that. Canada is a whole different animal of its own for sure.
mhm.
Because we've
It's really
tried to
hard.
figure out ways around it, ways that probably aren't the best way to do it, but we've tried to figure out ways around it
Yeah,
for them so that they could
yeah,
actually get some care because that's
yeah,
been a
yeah.
challenge.
It's really hard. Canada, I've seen Saudi Arabia, um, Qatar, Australia, New Zealand,
Wow.
but Canada has been the hardest.
They're just rough. They've just got a whole different, their whole medical system is a little
Yeah.
different. And it's
And they're
just,
very, I just spoke with one the other day and they're very, very, very traditional and
yes.
conventional and don't really want to think a little bit outside the box.
Yeah.
But I don't
The
know if
other
that
thing,
I don't know if that's their system that kind of dictates
I
that
think
and
it's their
people want
system.
to.
Yeah.
But it is Canada is very hard.
Yeah, Canada has been a because I have clients up there that we have tried to figure out a way to get them to see you because they need that up there so bad, but it's
Yeah.
just not open to, and that's the other thing is getting their medication. Okay, it's great. We get them in to see you, but then we got to
Yeah.
do the whole medication thing. So that's been a whole other challenge, but we'll figure it out one of these days. We're gonna figure out how to make it work.
Yeah. Well,
So
maybe one day we can be in Canada. I don't know. I think that's probably going to be, I think she's wanted to tackle the US first.
yeah, I think that has been her thing. Yeah, I think that's been the thing
Um,
is to get the US. So everybody in the US, I think everybody now aren't all 50 states.
I think there's three. Arkansas, South Dakota, and Alaska that we're still just kind of, I think we're just waiting on like the business thing to go through.
To go through
Everybody's license is just waiting for like the red tape to be
to be taken. So
taken
you're
off.
close,
Yep.
so close, which is crazy because just a year ago there was a whole lot that weren't on there yet, and now here we are.
Yeah.
To be down to
Yep.
3 states is pretty cool.
Yeah, it's taken a while and I don't really know why, but
I
I
think
think
there's a lot of red tape with all of that. I don't know. I can't imagine trying to jump
some
all the
states are
borders.
definitely very restrictive. Like Illinois took us, I think it took her 2 years to get to Illinois. California was very, very involved, and New York was very involved. And
Yes.
Massachusetts has been hard too. So there's just
Yeah.
been some that have been um hard.
Harder. Yeah. Yeah.
Yeah, like Florida, we got that super quick. Um,
I don't think Utah was too hard either. It came
oh,
pretty.
Utah was really easy. A lot of the like Southwest was really easy. So like New Mexico was pretty easy, Arizona was
Mhm.
pretty easy, Colorado was really easy.
I think we're
So
pretty easy on this side. It's when you get over to the other way that got a
yeah,
little crazy.
more northwest and
West.
northeast. A little
Uh-huh.
harder.
Little hard.
The Carolina, no, not the Carolinas. Maryland, I think, has been a little tricky too. So
Yeah. Yeah.
anyway,
There's
yeah.
some that are out there. Well, I appreciate you so much being here, and I know this is going to help a whole lot of people. So thank you
Yes,
very
ma'am.
much.
Well, I'm
And
glad to be here and hopefully I'll see some of them soon.
we will. We'll send lots of people to you because I already know a couple that will be. I'm like already
Yeah,
told them you
bring
gotta
them
go.
on.
You
Come
gotta go
on.
do it. Yeah.
Yeah, bring them on. I'll be happy to have them, or if they have to, if not have to, that sounds really bad, but if they see somebody else, I'm sure they
Well,
would be happy to have them as well. So
literally anybody at Modern Thyroid Clinic is
they
freaking
are.
phenomenal. So
They are.
whoever's in their state works just fine too.
Yep.
So
Exactly. Exactly.
all right.
Well,
Thank you so much, Hillary, and we'll talk to you again soon.
yeah. Bye, Gina.